This is a 79-year-old male patient who presented with abdominal pain and distension and significant constipation. The clinical query was bowel obstruction and CT scan was done. Let's see the images. As you can see, there is significant dilatation of the small bowel with air fluid levels. There is also a midline abdominal wall hernia, an umbilical hernia containing a small bowel loop. There are also some other findings, but these are out of the scope of this presentation to be presented. So let's concentrate at these findings. I will show you the sagittal and the coronal views as well. The coronal views, we can see the dilated small bowel loops. It's very important to see the whole bowel, the small and the large bowel, and to determine the site of the obstruction. As we can see, the large bowel, which starts here, just follow my arrow here. There is no dilatation of the large bowel. Let's follow it. Just follow my arrow. Here is the large bowel. As you can see, there is no dilatation. Here is the descending colon. Here is the sigmoid colon. Alright, so the next point is to see the rest of the bowel, the small bowel, and as you see, there are some collapsed small bowel loops. These small bowel loops are the terminal and distal ileum. Here is the terminal ileum. It is collapsed. So that means that the obstruction is proximal to that point. Now let's go to the umbilical hernia, and we can see a stenotic point at this region here. And probably in coronal views it's much more easier to see the bowel loop contained into the hernia. If you see on the right side, you can see the collapsed part of the peripheral small bowel, which is here. As you can see, these small bowel loops are collapsed. This is the peripheral part. But at this point, there is a stenotic point. And if you compare this small bowel loop with the rest of the small bowel loops, you will see some very important difference. There is fecalization of this small bowel loop, and the reason is that there is reduced outflow due to the stenosis, so there is fecalization because of this reduced outflow of the bowel. And this, as a general rule, can be the leading point to find easy the level of the bowel obstruction. So every time you see a small bowel loop with fecalization, probably at this side you can find the stenotic and the transitional point. This is a very helpful sign to find easy the site and the level of a small bowel obstruction. Thank you for watching. If you like my videos, please subscribe to my channel so you will not miss my next presentation. Thank you.